Hello and welcome to Wellness Wednesday with 3W. This is Beth Chase, your host for today's broadcast. Well, I have with me in the studio Helen Nguyen again, which is so wonderful because she has a wealth of information about reproductive health issues for the Seattle area and also about 3W. It's because Helen is the executive director of 3W. Now, 3W is a medical clinic that specializes in reproductive health services for women in the Seattle area. Well, okay, Helen, I know that we've got a lot of things to talk about, and this particular topic, I think we both are eager to get it out there because we don't like confusion, do we?
No, we don't.
We like clarity, honesty, integrity, real. So let's talk about today about the 3 myths that we have heard from time to time, not all the time, but from time to time, about the 3W Medical Clinic. So Helen, what are these 3 myths?
Yeah, the first myth that we're going to kind of debunk is 3W a fake clinic? And let me just tell you right now, we are not. And the reasons why we are not is that we have real licensed medical providers here. And these providers would not have gone through years of school to work at a fake clinic. They would not jeopardize their license or their reputation to work at a place that's deemed as a fake clinic. So that's pretty logical. The next thing...
Wait, before you get into that, but who are the key medical players? Providers here.
So we have Dr. Susan Rutherford. She is our medical director and the president of our organization. You can read all about her in her bio. She's actually an alumni of the University of Washington. You can read more about her and her credentials on our website.
Mm-hmm. Okay.
Yeah. And then we also have multiple nurses as well as nurse practitioners who volunteer with us that have jobs at either Seattle Children's Hospital, Evergreen Hospital.
Mm-hmm.
Yeah.
Mm-hmm. So all of your services that you provide are performed by licensed medical professionals.
Correct.
Mm-hmm.
Yes.
Okay.
Yeah.
Okay. And then also I'm sorry you were starting to talk about this,
no
I'm
problem.
sure, and I interrupted you, but about another reason why we absolutely cannot be a fake medical clinic. What was that?
Well, last fall, around October or November, we received our accreditation through the Accreditation Association for Ambulatory Healthcare. What we usually say is AAAHC, because that's such a mouthful. But you will see that on our website. You'll see that on all of our paperwork. And with this accreditation, it really solidifies and demonstrates our organization's commitment to providing safe, high-quality services to patients. We received this accreditation after a whole day of a surveyor coming and literally going through all of our policies with a fine-tooth comb and making sure that we're providing the highest quality of care, the latest type of care for our patients. And they do not give out this certificate lightly to anyone. And they especially do not give this accreditation to fake clinics. Mm-hmm. So we were awarded this accreditation after years of really hard work, actually, from the medical team to make sure that we pass it the first time, and we sure did with flying colors.
Mm-hmm. Well, it's my understanding that AAAHC is similar to the Joint Commission that goes in and they provide accreditation for hospitals.
Yes.
And so, I can't imagine a hospital in existence providing services for patients that are not accredited. Mm-hmm. By most of the time it's JACO. Even AAAHC, I understand, is that they also can do hospitals as well.
Yes.
But they don't as much.
Well, in fact, they do accredit hospitals. Actually, I think about 29 clinics and or hospitals in this area specifically. And the closest one to us is the University of Washington.
Oh.
We have the same accreditation company.
Okay. As the hospital?
The whole UW medical system.
The whole UW medical system.
Yeah. So the Hall Health clinic that sees primarily students on campus as well as the UW Medical Center.
Okay.
Yeah.
All right. So that just really, I think, indicates how you are so committed to the safety of clients and patients. So I think an important thing to repeat here is that just like JCAHO does not provide accreditation or accreditation services for a fake hospital, AAHC does not provide an accreditation status for fake medical clinics. It just doesn't exist.
No, it does not.
Okay.
Yeah.
You know, I oftentimes wonder, Helen, where did this fake medical clinic come from? I don't understand.
I have no idea. It seems like it comes from people who've never even have stepped foot in our clinic, have spoken to us. Have they met Dr. Rutherford? I don't know. Have they met me and had a meeting with me? I welcome it, actually. If you have any questions about who 3W is, why we exist, who we serve, please, I'm accessible. You can find my email and phone number on our website, and please reach out to me and make an appointment and talk to me so that we can clear up these types of myths about why 3W is here and why we want to serve the community.
Well, you know, it's very common, I think, in human beings to not understand something that's different. And one thing for sure that 3W is that it's unique. It has a business model where 3W does not make any money from the choices that women make. Their focus is on education, providing medical services, helping women to think through the questions that they need to ask, and helping them to come up with, or I guess the better word is empowering them, giving that empowerment to make a decision that they really want to make, that they're not feeling forced to make. And so by coming here, they don't have to worry about that we have an agenda or that we want to sell them something. So I think there might be an element of that, not with all, but I think with some people, they just don't understand why something like 3W would exist, which is solely motivated by caring deeply for women.
Exactly. Yeah.
Okay. So, you know, this has come up also, Helen, and again, I have a hard time understanding really why, but I think because we're just different. But, you know, we've been asked if we're a crisis pregnancy center. And so can you tell me what your response to that would be?
Yeah, how I would describe 3W is that we're a real women's clinic, which is bizarre to me that I even have to emphasize the real part. And that is very transparent. If you look through our list of services on our website or on any of our brochures, or if you wanted to give one of our staff a call, we do more than just pregnancy services. We understand that the community that we're serving is asking for more than just pregnancy services. And so we wanted to meet those needs within the scope of practice that we can do the best. And so we provide STI testing and treatment for both partners. We provide GYN consults, OB consults, especially first trimester. We very much want to emphasize the importance of first trimester care if you are pregnant. We provide
Well Women Care.
Yes, Well Women Care. And we have very low prices for Well Women exams. Your pap smear is what I'm referring to. It's only $18.50.
Oh, but that's the lab fee, right?
That's only the lab fees. The consultation and the exam with Dr. Rutherford or any one of our medical providers is completely free to you. So what's there to lose? Give us a shot and make up your own mind of if we're a real medical clinic or not. So I can't wrap my head around it, but I think this is good to talk about because sometimes it's easy to, like I said, I think there's an element of not understanding us because we're just unique, but also perhaps people come up with an agenda that really don't like the fact that we don't charge. And we do provide that safe space for women to come to be empowered to make choices that are right for them at no cost, none at all. Yeah, and I just want to emphasize that we're very transparent about the services that we don't provide. We have a whole page on our website dedicated to explaining to you the services we don't provide, so that there's no mystery to us, is what I'd like to say. We're very transparent. And you will hear that if you call our office, or if you come here and ask for a service that we don't provide, you will hear the same thing from all of our providers. And we, being a private nonprofit, I think that we have the right to say what we want to provide and what we don't provide. If there's something that you want that we don't provide, then I think that you're smart enough and capable enough of finding that. So we provide the services that we provide because we know we can do it the best.
Mm-hmm. Yes, and I think it's just a fair thing. We talk a lot about the value of fairness, about the newcomers. Mm-hmm. And personally, I just have to admit, I felt like some of the things that were being said about us were just not fair. Mm-hmm. It was unfair. So I think it's good to kind of clear up some of these misconceptions and clear the air. So yes. What's the third myth that you want to talk about today?
Yeah, the third myth is, we get a lot of questions about this, is 3W a religious organization? Mm-hmm. And we are not. Mm-hmm. We do not have a statement of faith. We are an official 501c3 nonprofit filed with the state of Washington. You can look that up. Again, we're very transparent about it. If you want to come in and look at our 501c3 document that was given to us by Washington State, more than happy to make you a copy of that. Mm-hmm. So again, when you come here, you know what you're going to get. We're very upfront with that. So we're not a religious organization. We don't push any type of religion onto our patients.
Mm-hmm. But on the other side, I know that some of our staff and some volunteers are very spiritual people.
Yeah. And we're allowed to be that way.
Right. That's only fair, is that if they are spiritual people, they have the right to be spiritual people with their faith. So, and we like to, because I think at 3W, one of the core values is to approach a woman's healthcare from a holistic perspective. Right. Can you talk about that a little bit?
Yes, we take into account not only the immediate health issue that the patient came in with. We want to assess her mental health, her physical health, her spiritual health. All of that plays into why she came in for this specific issue today. And, because we have unrushed up to an hour types of appointments with a medical provider, it's really wonderful that we can look at a patient as a whole person. And to when we make a diagnosis or an assessment, we get to take into all those factors that contribute to that one issue. And we encourage patients, hey, if we run out of time, you're more than welcome to come back and talk to us multiple times. There's no limit to how many times you can come back and speak with a medical provider, because we want to build that relationship with this community as well as with our patients. You are important to us. And so taking in all those different aspects of healthcare really helps shape what type of care you will get here at 3W. And that's always high quality and compassionate care.
Mm-hmm. Okay, let's review.
Yeah.
The first one is the question about being a fake medical clinic. Mm-hmm. So your response again is?
We are not a fake medical clinic. We have real medical providers here, and we are also accredited through AAAHC.
Second myth is, is 3W a crisis pregnancy center?
We are not a crisis pregnancy center. We are a real women's clinic that focuses on reproductive health. Please look at our services page to see the variety of services we provide.
Mm-hmm. And 3, is 3W a religious organization?
We are not a religious organization. We are a 501c3 nonprofit healthcare provider that's filed with Washington State.
Okay, well, I just really appreciate this, and it's just good to get truth out. So unfortunately, it's time to wrap this up at this time, and just want to say a special thank you to Helen for coming in and clarifying this. I know that you are so busy, and you're so gracious with your time to be a part of this these podcasts. But there's just always so much to talk about, isn't there?
Yes. So many topics.
Yes. Now, before we wrap this up, there is a companion resource tool that you are going to make available on the website. Tell us about that.
Yes, I will provide just a recap of what I just talked about in a written form so that if you have any more questions or if you're talking to someone that may have communicated these myths with you, that you could back up with facts and information that I provided with you today.
Okay. So you can find these 3 myths with Helen's response by going to our website at 3wmedical.org. That's the number 3, the letter W, and medical.org. And when you get in there, just click on the Wellness Wednesday tab at the top of the page, and there you will find this resource that we told you about. There's also a place where you can do 2 things. Number 1, you can sign up for our monthly e-blast, where we can send you, or we're sending out more information about our topics that we're discussing on these episodes. And there's also a place where you can send a question in, or type a question in the box for Dr. Sue, and we will be answering those questions at one of the episodes up and coming. So I hope you found this episode helpful, and until next time, stay healthy and be well.